Alzheimer's disease can be devastating not just for the patient but for all of their loved ones too, especially at Christmas. Dementia, which is an umbrella term for a group of symptoms that affect the gradual decline of the brain, is thought to affect nearly 1 million people in the UK. It often starts out slowly, meaning the symptoms can be difficult to spot at first. But one expert has highlighted some lesser-known signs that can present themselves at social gatherings, that you might not have heard of before. Many people will already be aware that memory loss and language issues can be a telltale sign that a person may have dementia. But behaving in a way that's out of character and becoming socially withdrawn are just two less common symptoms of the devastating illness, according to Dr. Byron Crease, a senior lecturer in psychology at Brunel University in London. Speaking exclusively to The Express, he explained how these symptoms and more should set off alarm bells if they're spotted. He said, "It is important to look out for behavioral changes such as agitation, aggression, mood changes, anxiety, social withdrawal and changes in behavior that were not there before." These behavioral symptoms can emerge as new symptoms in older adults who are cognitively normal, and there is emerging evidence that they might be the first sign of an underlying disease like Alzheimer's in some people. Noticing these changes in personality could be more of an indicator for Alzheimer's than just relying on memory loss as a symptom. Dr. Crease said, "When these kinds of symptoms occur alongside memory and thinking problems, they seem to signal the greatest risk of dementia compared with memory and thinking complaints alone. This is because other symptoms such as memory loss and language problems might leave them frustrated, agitated and confused, which will only get worse as the illness progresses," according to the Alzheimer's Society. The charity says, as dementia progresses, you may see more changes in the person's behavior and find this difficult to manage. Looking at their causes and identifying the person's needs can help. However, it adds, when a person with dementia starts to behave in ways that seem out of character, some people may assume this is a symptom of the condition itself, which isn't always the case. It's important to see beyond the behavior and think about what may be causing it. For example, they may no longer be able to do things they enjoy or follow their interests without help, or they may experience symptoms of depression. Knowing the person, how they react to and deal with things, their preferences, routines and history, can help when it comes to supporting them.